Hello everybody, Dr. Luis Gavin from Dubai. I'm an oral maxillofacial surgeon, King's College Hospital in Dubai. I'm from Spain, and I want to talk about how we can know a patient has this condition named temporomandibular joint or TMJ. For that we use different items that I personally developed, like these small pieces we put inside the mouth. Why? Because many times it's because a problem in the bite. Also these sophisticated 3 dimensions, I use myself as a model. Put it in the mouth, and in these 3 different colors we can change, and we look which dimension in the lines of the face or the bite, the symmetry of the face is affecting this condition or this joint named temporomandibular joint. And also times we use an electrostimulator just to determine which muscles also they are suffering or they are working excessively, provoking this pain. Times also we use, why not, this well-known medical instrument to hear the noises inside the joint. And times also we use this stimulator to trigger the points where are painful, assisting you again in the neck, in the shoulder, on the face, in the joint, even in the head.